This is Dr. Duenas, and we're here with Joe Lewis. And Joe Lewis is a patient in our office. And Joe, if you wouldn't mind telling me, what's the reason you originally came in for?
Originally I came in for some severe back pain. I couldn't actually walk. I went over to a couple different chiropractors and for actually quite a few years, and didn't have any luck with those other chiropractors. Came in here with some severe lower back pain.
Okay. Now, once you came in, we took X-rays and we found that you had a tilt of your low back, and that had never been addressed, correct?
No, not like I said with the other the other doctors. Everyone I've ever seen never even considered that, which was surprising to me once I came in here.
Okay. Well, in this office we do chiropractic biophysics, and our goal with you was to change that posture. So you underwent some corrective care, correct?
Yes.
You did that for how long?
I believe it was for 3 months.
3 months, correct. And what did the post X-ray show? Was the spine corrected after that?
Yeah, it was completely straight. I was very surprised in a matter of a short time, I think. Yeah, it straightened right up.
Would you say the treatments were painful?
The treatment's painful? No, I don't. For me, it wasn't the treatment itself. Just the just having the disc problems was very painful.
Right. Okay. Now, what happened to your symptoms after that? That they subsided? Was it better than it was before?
It was 10 times better. I was able to walk again without limping.
Good.
Yeah, it was just a lot better.
Okay, very good. Now, during the time you were here, we also discovered that you have some digestive problems and distresses, and you were seeing your medical doctor for that at the time.
Yeah,
and
ulcerative colitis.
Okay. And so because of that, you underwent a detox program here where you took some supplements, and we guided you on certain types of what to eat, what not to eat. And how did you do with that?
I think I did pretty good, actually. And not only I think taught me a lot about how to eat, how to certain foods, just all around, as far as taught me a lot of different things about my body that I didn't know. And return, I haven't had any problems with my colitis since then. It's probably been about 2 years, I would imagine. I haven't had one flare up, and I spent actually 7 days in the hospital from it just about five or 6 years ago. So to not have any pain or anything like that from my colitis is actually a pretty good thing.
Good, very good. And lastly, as you know, we do a lot of comprehensive care. You also underwent some training with our personal trainer, Dexter Bowel. Did you find that to be beneficial?
Yeah, another good thing. Dexter is a pretty good guy, personal trainer. Teach me a lot of different things because of my disc injuries. Teaching me how to kind of strengthen my core, my back muscles, getting that properly tuned in, I guess, so to speak. And yeah, I just feel a lot better, especially with his knowledge and all the muscles, and especially I'm not sure if he's a nutritionist or not, but he certainly has the qualifications for one. So yeah, it's been a real pleasure working with Dex.
Okay. So overall, would you say you've been pretty happy with the care you've received in this office?
Certainly, without a doubt.
What advice would you give other patients who perhaps were thinking of beginning care at this office?
Advice, I wouldn't recommend anyone else. If there's nobody here. I've seen quite a few chiropractors in the Island Valley, and there's really, I have to say, you guys got a pretty good practice over here, and I'm glad you guys are here.
Good.
Just by chance, I looked in the, actually found you guys on the internet. You had a pretty good staff here. I called up within a matter of an hour. You guys had me in, which I was surprised. Just kind of, just your staff getting me in. So I'm pretty blessed to be here.
Very good. And last question, do I have permission to show this tape to other patients, students, and doctors?
Certainly.
Yeah. Well, thank you very much, Mr. Lewis.